I'm Dr. Donald Hohman, board certified orthopedic surgeon, fellowship trained, and I specialize in joint replacements of the hip and the knee. Knee replacement is performed through a straight midline incision. The length of the incision depends on really the size of the leg. The important parts of joint replacement around the knee are getting the pieces into the right position so that the leg is well balanced and works well. And so an appropriate sized incision depends on the size of the patient. All of the research that exists around the various approaches for a knee replacement are essentially equivalent. And so I do a standard midline entrance into the knee through the tendon portion of the knee. We try to avoid any of the damage to the musculature of the knee. We perform as minimally invasive procedure as possible with special care, with minimal dissection around the knee, meticulous control of the bleeding to try to minimize any inflammation and irritation around the knee after the operation. Try to perform the procedure with all of those considerations in mind. We do a lot of things around the time of surgery for pain management. So we introduce pain medicine locally around the knee, as well as systemically even before the operation, with a series of multimodal pain management options even before surgery. And a speedy operation, usually in about 35-40 minutes we can have a knee replacement performed and start to close it up, so that there's minimal exposure to any of the downsides to joint replacement. The longer that the incision is open, the higher the chance of having an infection or something that could make it in there that we don't want in there. So performing the procedures in an efficient manner, doing what has to happen in as efficient process as possible, also helps people in the long term minimize their risk of having problems. Just a very careful, meticulous process for getting the incisions closed, getting those tendons closed, and getting people back to action and rehabbing quickly. We have people up moving around as soon as they are able to do so afterwards. So oftentimes, even within a few hours, we have people up moving around after a hip or a knee replacement, and they're starting their therapy almost immediately. So it's as quickly as possible.